Welcome to another episode of our medical podcast with Dr. Neopsych. In this episode, we provide a concise yet comprehensive overview of HbA1c, a crucial marker in diabetes management. This episode is designed for healthcare professionals, medical students, and anyone interested in understanding the significance of HbA1c in clinical practice. What is HbA1c? HbA1c, or glycated hemoglobin, is a form of hemoglobin that is chemically linked to glucose. It reflects the average blood glucose levels over the past 2 to 3 months because red blood cells have a lifespan of about 120 days. The higher the blood glucose levels, the more glucose binds to hemoglobin, resulting in higher HbA1c levels. Clinical significance: importance in diagnosing and monitoring diabetes. Diagnosis: HbA1c is a key indicator for diagnosing diabetes and prediabetes. An HbA1c level of 6.5% or higher on 2 separate tests typically indicates diabetes. Monitoring: it is crucial for monitoring the long-term control of blood glucose levels. In people with diabetes, regular HbA1c testing helps assess how well the diabetes management plan is working. Testing and interpretation: guidelines on measurement and interpretation. Testing: HbA1c is measured using a blood test, which can be done at any time of the day and does not require fasting. Interpretation: normal is below 5.7%. Prediabetes is 5.7% to 6.4%. Diabetes is from 6.5% or higher. Frequency: the American Diabetes Association recommends that people with diabetes get their HbA1c tested at least twice a year if they are meeting treatment goals, and quarterly if therapy has changed or goals are not being met. Management implications: influence on treatment decisions and patient management. Setting goals: individualized HbA1c targets, often around 7% for many adults with diabetes, but can vary based on patient age, comorbidities, and risk of hypoglycemia. Treatment adjustment: high HbA1c levels may lead to adjustment in medications, lifestyle changes, and more frequent monitoring. Complication prevention: maintaining optimal HbA1c levels helps reduce the risk of diabetes-related complications such as neuropathy, retinopathy, and cardiovascular diseases. Tips for patients: practical advice for maintaining optimal HbA1c levels. Healthy diet: emphasize a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Limit sugars and refined carbohydrates. Regular exercise: encourage at least 150 minutes of moderate intensity exercise per week. Medication adherence: take prescribed medications consistently and discuss any side effects with a healthcare provider. Regular monitoring: keep track of blood glucose levels regularly and understand how daily activities affect these levels. Routine checkups: maintain regular appointments with healthcare providers to monitor and adjust the treatment plan as needed. Stress management: practice stress-reducing activities such as yoga, meditation, or hobbies to help manage blood sugar levels. Education: stay informed about diabetes and its management through reliable sources and support groups. Thank you very much for listening. You can find the show notes in the description below. I suggest you like, comment, and subscribe. So we'll meet in the next episode.